In this video, we're going to look at asthma in adults. This is an overview and introduction. Asthma is a common lung disease affecting millions of people. Asthma is caused by narrowing of the airways in the lungs. Asthma can be treated successfully and is also related to other atopic disorders. Here I'm drawing the left and right lung. The trachea bifurcates into the left and right lung. The trachea gives rise to bronchi, which branch into smaller and smaller bronchioles until the alveoli. The normal bronchiole have smooth muscles, which help in narrowing and dilating the lower respiratory tract. The respiratory tract is also covered with mucus, which helps in protecting the airways. In asthma, there are three important changes. You have smooth muscle contraction, which narrows the airways, smooth muscle hypertrophy, and mucus hypersecretion, all of which contributes to the narrowing of the airways. These three features results in the signs and symptoms of asthma, which include cough, dyspnea or shortness of breath, and an expiratory wheeze. People with asthma also may present with recent respiratory tract infections. There are some things you can also see inside the nose. On the nasal conchae, you may see nasal polyploids, which can be a sign or a risk factor. The risk factors for asthma include having a family history, atopic history, an allergy, having nasal polyploids, having GORD, and obesity. Investigations for asthma. Gold standard is measuring the peak expiratory flow rate, which is a test that measures how fast a person can exhale, can breathe out, and this tests lung function. There is also the spirometry, which in asthma shows an obstructive pattern. The spirometry will give you an FEV1 over FVC ratio, which is your forced expiratory volume at 1 second over your forced vital capacity. This ratio is important in diagnosing obstructive diseases, including asthma. A normal inspiration and expiration measurement will have sufficient volume and flow on the graph. In asthma, there is decreased inspiratory volume and expiration shows an obstructive pattern. A FEV1 over FVC ratio of 80% of predicted or less is diagnostic for asthma. Administration of a bronchodilator will improve lung function.